Imagine this. You feel a slight change in your vision. Maybe reading small print is harder, or colors seem less vibrant. Or perhaps you notice little aches and stiffness that weren't there before. These aren't just random occurrences. They're often gentle nudges from your body, signals that its needs are shifting as you move through life's seasons. Your health journey in your 60s and beyond isn't about decline. It's about understanding these changes and having the knowledge and tools to navigate them effectively, ensuring your days are filled with vitality and capability. It's about supporting your body's incredible resilience. As the years pass, certain physical shifts become more common. One of the most noticeable areas is vision. For many, the need for vision correction, like bifocal or progressive lenses, becomes a daily reality, helping the eyes focus on objects at different distances. This is often due to presbyopia, a natural hardening of the lens of the eye over time. Beyond needing glasses for reading or distance, more significant vision issues can emerge, such as cataracts, which cause clouding of the lens, leading to blurry vision. Other concerns include glaucoma, a condition often linked to increased pressure inside the eye that can damage the optic nerve, and a detached retina, where the light-sensitive tissue at the back of the eye pulls away from its supporting layers. These conditions require professional medical attention and regular monitoring. The impact of these vision changes goes beyond just seeing clearly. They can affect balance, mobility, ability to read, drive, and maintain independence. Regular comprehensive eye exams with an ophthalmologist or optometrist are crucial. These professionals can detect issues early, often before you notice symptoms, offering treatments that can preserve vision and quality of life. Discussing any subtle changes you notice, even if they seem minor, is vital during these appointments. Understanding the potential progression of age-related eye conditions empowers you to take proactive steps and seek timely care, supporting your ability to continue engaging fully with the world around you. Oral health also presents evolving considerations. Tooth decay and gum recession can become more prevalent. Gum recession, for instance, can expose the tooth roots, making them more susceptible to decay and sensitivity. Dry mouth, often a side effect of medications commonly taken by older adults, can also contribute to these issues because saliva plays a crucial role in neutralizing acids and washing away food particles. Maintaining meticulous oral hygiene becomes even more important. Brushing thoroughly twice a day, flossing daily, and using fluoride toothpaste. Regular dental checkups are not just about preventing cavities. Dentists can identify signs of gum disease, oral infections, or other issues that can impact overall health. Inflammation from gum disease, for example, has been linked to other systemic conditions. Discussing your medication list with your dentist is important, as they can offer strategies to manage dry mouth and other oral health challenges. For those with dentures or other dental prosthetics, proper cleaning and regular checks for fit and condition are essential for comfort, function, and preventing oral irritation or infection. Accessible and affordable dental care is a significant factor in maintaining health and well-being throughout the senior years. The concept of anti-aging has evolved, often focusing now on promoting vitality, functional capacity, and overall well-being as we age, rather than solely on appearance. Clinics or health programs that adopt this philosophy often take a comprehensive approach, looking at a person's health holistically. This can involve in-depth health assessments, nutritional guidance, personalized exercise plans, stress management techniques, and monitoring of various biomarkers. The goal is to optimize physical and cognitive function, enhance energy levels, and support the body's natural processes to promote health and resilience over time. These approaches emphasize preventive strategies and lifestyle adjustments tailored to individual needs and health profiles. Engaging with healthcare providers or wellness programs that focus on this comprehensive view can provide valuable support and insights for navigating the complexities of aging well. It's about investing in your health journey with informed choices and consistent habits that support a fulfilling and active life. Environmental factors, such as exposure to smoke, continue to pose challenges regardless of age. Even occasional exposure to secondhand smoke, or having a history of smoking yourself, can significantly impact health. The respiratory and cardiovascular systems are particularly vulnerable. Smoke contains thousands of chemicals, many of which can irritate lung tissues and contribute to inflammation throughout the body. For individuals who have smoked in the past, quitting, even after many years, offers significant health benefits. The body begins to repair itself relatively quickly after stopping smoking. Circulation improves, lung function can see gains over time, and the potential for developing serious respiratory or cardiovascular issues is reduced compared to continuing to smoke. For those who have never smoked, avoiding exposure to secondhand smoke environments is the most protective measure. If family members or friends smoke, having open conversations about smoking outdoors or away from shared indoor spaces can help create a healthier environment. Quitting smoking is one of the single most impactful actions you can take for your health at any age, and resources like quit lines, support groups, and cessation aids are available to help. It's a journey that can add not just years to life, but life to years, improving breathing, energy, and overall sense of well-being. Supporting loved ones who are trying to quit is also a meaningful way to contribute to their health journey. By the time you reach your 60s, or even earlier, considerations around blood circulation may become more relevant. The cardiovascular system undergoes natural changes over time. Arteries can become less flexible, and plaque can build up within their walls, a process known as atherosclerosis. This can narrow the arteries, restricting blood flow. Efficient circulation is vital for delivering oxygen and nutrients to all parts of the body and removing waste products. Compromised circulation can affect the heart, brain, limbs, and other organs. Conditions like high blood pressure, high cholesterol, and diabetes can accelerate changes in circulation. Recognizing the signs and symptoms related to circulation issues is important. These can include cold hands and feet, swelling in the legs or ankles, numbness, or pain in the legs when walking. Taking proactive steps to support healthy circulation involves a combination of lifestyle habits and regular health monitoring. This includes engaging in regular physical activity, maintaining a heart-healthy diet, managing weight, avoiding smoking, and keeping conditions like blood pressure and cholesterol levels within recommended ranges. Your doctor can assess your individual risk factors and recommend specific strategies or treatments to support optimal circulation as you age. For a healthier and more vibrant life as you age, several key areas deserve attention. We've touched upon quitting smoking and the benefits it brings. Physical activity is another cornerstone. Aiming for at least 30 minutes of moderate intensity exercise most days of the week is a widely recommended guideline. This doesn't mean you need to hit the gym every day. It could be brisk walking, swimming, cycling, dancing, or even active gardening. The key is consistency and finding activities you enjoy. Physical activity benefits circulation, strengthens the heart muscle, helps manage weight, improves balance and coordination, reducing the risk of falls, boosts mood, and supports bone density. Even shorter bursts of activity throughout the day can be beneficial if a full 30 minutes at once is challenging. Good nutritional habits are equally important. Focusing on a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats provides the body with the fuel and nutrients it needs. Paying attention to portion sizes can help manage calorie intake and maintain a healthy weight, which in turn supports cardiovascular health and reduces strain on joints. Hydration is another critical, yet often overlooked aspect of nutrition. Drinking enough water throughout the day supports digestion, circulation, and overall cellular function. Small, consistent efforts in physical activity and nutrition can yield significant positive impacts over time, supporting energy levels and the body's capacity to function well. Regular health monitoring, specifically through blood work, provides valuable insights into your internal health. Checking blood pressure, cholesterol levels, and blood sugar levels is standard practice and incredibly helpful in identifying potential issues early. These markers are indicators of cardiovascular and metabolic health. For instance, monitoring blood pressure helps assess the force of blood against your artery walls. High blood pressure often has no symptoms but can quietly put strain on the heart and blood vessels over time. Similarly, high cholesterol levels, particularly LDL, bad cholesterol, can contribute to plaque buildup in arteries without causing noticeable symptoms until it reaches a significant level. Monitoring blood sugar levels is important for managing diabetes or identifying prediabetes, as persistently high sugar levels can damage organs and blood vessels over time. Regularly reviewing these lab test results with your healthcare provider is essential. They can explain what the numbers mean for your specific health profile, discuss trends, and recommend appropriate interventions, which might include lifestyle changes, dietary adjustments, or medication. These tests serve as an important tool for proactive health management, allowing for adjustments to your health plan based on objective data. Understanding your numbers is a powerful step in taking charge of your health journey. Kidney function is another aspect of health that warrants attention as we age. The kidneys play a vital role in filtering waste products, including excess sodium, from the blood. As part of the natural aging process, kidney function may gradually change for some individuals. Excessive sodium intake can pose a challenge to the kidneys and contribute to elevated blood pressure, which in turn can further impact kidney health. Keeping your sodium intake under recommended levels is beneficial for both blood pressure control and supporting kidney function. The recommended daily sodium intake is typically no more than 2,300 milligrams, and many health organizations recommend aiming for even lower, such as 1,500 milligrams per day, especially for individuals with existing blood pressure concerns. Sources of high sodium are not just the salt shaker. Processed foods, packaged snacks, restaurant meals, and even seemingly innocuous items like bread and sauces can contribute significantly to your daily intake. Becoming mindful of food labels and choosing fresh, unprocessed options more often can help manage sodium intake effectively. Your doctor can assess your kidney function through simple blood and urine tests and provide personalized guidance on managing sodium intake and other factors to support kidney health. Addressing elevated cholesterol levels is a significant step in supporting cardiovascular health. High cholesterol is often referred to as a silent factor because it typically doesn't present with symptoms until it has contributed to significant plaque buildup in the arteries. This plaque can narrow or block blood vessels, restricting blood flow and potentially leading to serious cardiovascular events. Focusing on lowering LDL cholesterol is usually a primary goal. Lifestyle changes play a crucial role, adopting a diet rich in fiber, plant sterols, and healthy fats, like those found in olive oil, avocados, and nuts, while limiting saturated and trans fats can help. Regular exercise also positively impacts cholesterol levels. For many, medication, such as statins, is a necessary and effective component of managing high cholesterol when lifestyle changes alone are insufficient. Aiming to keep your LDL cholesterol below 120 milligrams per deciliter is a common target, though your personal goal may vary based on your overall cardiovascular risk profile, which your doctor will determine. Monitoring your cholesterol levels through regular blood tests is essential to track progress and ensure that your management strategy is effective. It's an ongoing process of informed choices and consistent care. Stress management is a critical, often underestimated component of overall health, particularly as we age. While stress is a normal part of life, chronic or unmanaged stress can contribute to a range of physical and emotional health challenges. The body's stress response, designed for short-term threats, when activated persistently, can lead to elevated levels of stress hormones like cortisol. Over time, this can influence various bodily functions, potentially contributing to unhealthy lipid levels, increased inflammation, and putting extra strain on the cardiovascular system. Stress may not be visible on the outside, but its impact can accumulate over the years. Finding effective ways to manage stress is not a luxury. It's a necessity for supporting long-term well-being. There are many accessible techniques. Simple practices like deep breathing exercises, even for a few minutes each day, can help calm the nervous system. Spending quiet time sitting peacefully, perhaps engaging in meditation or mindfulness, can reduce feelings of being overwhelmed. Gentle movement activities such as Tai Chi or yoga combine physical activity with mindful breathing and relaxation. Spending time in nature, whether it's a walk in a local park or simply sitting outdoors, can have a restorative effect. Connecting with friends, family, or a trusted confidant to talk through concerns can provide emotional release and support. Listening to soothing music, engaging in hobbies, or practicing small acts of kindness for others can shift focus and promote positive emotions. Establishing relaxing bedtime routines and avoiding stimulating activities like intense television or phone conversations before sleep can also help manage stress levels and improve sleep quality. If stress feels overwhelming or persistent, talking to a healthcare provider or a mental health professional can provide additional strategies and support tailored to your needs. Recognizing the impact of stress and actively incorporating management techniques into your routine is an investment in your physical and emotional health. Focusing on blood sugar levels is also a key aspect of health management, particularly for those at risk for or living with diabetes. Maintaining healthy blood sugar levels is crucial for preventing complications that can affect the heart, kidneys, eyes, and nerves over time. While average fasting blood sugar levels ideally fall below 100 milligrams per deciliter, and levels after eating rise but return to a healthy range within a couple of hours, for individuals managing elevated levels or diabetes, the target ranges may be different. Consistent monitoring, whether through finger stick tests or continuous glucose monitors, provides essential data for managing blood sugar effectively. Dietary choices significantly impact blood sugar. Focusing on complex carbohydrates, fiber, lean proteins, and healthy fats, while limiting added sugars and refined grains helps regulate blood sugar levels. Regular physical activity also plays a vital role by helping the body use insulin more effectively. If you are on medication to manage blood sugar, adhering to the prescribed dosage and timing is critical. However, any changes to diet, exercise, or medication should always be discussed with your doctor or a certified diabetes educator. They can help you establish personalized goals and develop a safe and effective management plan. Understanding the connection between food, activity, medication, and blood sugar levels empowers you to make informed daily decisions that support your long-term health. Consistent exercise is fundamentally irreplaceable when it comes to building physical strength, improving cardiovascular function, supporting circulation, and enhancing overall resilience. No supplement can fully replicate the wide-ranging benefits that regular physical activity provides across multiple bodily systems. It's not just about maintaining muscle mass or managing weight. Exercise helps regulate blood pressure, improves cholesterol profiles, supports healthy blood sugar levels, reduces inflammation, and contributes to cognitive health and mood. Finding the right intensity and duration for your individual fitness level and health status is important. This might mean starting slowly with shorter durations or lower intensity and gradually increasing over time as your fitness improves. Listening to your body and knowing when to rest and recover is also crucial. Adequate rest allows muscles to repair and rebuild and prevents potential strain or injury. Without sufficient recovery time between exercise sessions, the body doesn't fully benefit from the activity. Balancing activity with rest is key to a sustainable and beneficial exercise routine. Consulting with a healthcare provider or a physical therapist before starting a new exercise program is always recommended, especially if you have any underlying health conditions. They can help you determine appropriate activities, intensity levels, and safety considerations. Navigating the healthcare system, including understanding different types of insurance, is another important piece of the puzzle for seniors in the U.S. Medicare. Is the primary health insurance for most individuals aged 65 and older, but understanding its different parts, A, B, C, D, and how they cover various services, hospital stays, doctor visits, prescription drugs, can be complex. Many seniors also consider supplemental insurance plans to help cover costs that Medicare doesn't fully pay for. Having adequate insurance coverage impacts access to care, including regular doctor visits, specialists, necessary tests like blood work and vision checks, and medications. The ability to easily access and afford these services is fundamental to maintaining health. Understanding your coverage and how it works can help you utilize healthcare resources effectively and avoid unexpected costs. Resources are available to help navigate Medicare and insurance options, including government websites, nonprofit organizations, and insurance counselors. Taking the time to understand your options is a practical step towards ensuring you can access the medical support you need when you need it. Ultimately, supporting your health journey in your 60s and beyond is about integrating informed decisions and consistent habits into your daily life. It's about recognizing that your body is incredibly adaptable and responsive to care and attention. While your heart, like every organ, changes with age, you have significant influence over how well it functions by making heart-healthy choices regarding diet, exercise, and stress management. It's about staying diligent with recommended screenings and appointments, using the knowledge gained from regular checks, like blood pressure, cholesterol, and blood sugar, to guide your actions. It's about embracing the power of prevention and the benefits of early intervention. It's also about nurturing connections with others, friends, family, or support groups, as social connection plays a vital role in emotional well-being and can even influence physical health outcomes. Discussing health concerns with someone you trust, whether it's a family member, friend, or healthcare provider, can provide comfort, perspective, and practical support. Keep taking steps to care for your physical and emotional health. It's an ongoing process of learning, adapting, and making choices that support a vibrant and fulfilling life. What aspects of your health journey feel most important to focus on right now? Sharing your thoughts or experiences can help others in their own journey. Considering small, achievable steps you can take this week towards one of these areas, perhaps increasing your water intake, trying a new gentle exercise, or reaching out to schedule a checkup, can make a meaningful difference. Your health is a valuable asset, and nurturing it allows you to continue enjoying life to the fullest.